When the patient comes in to have their toenail removed, first of all, we would bathe the foot in a solution of betadine so that the skin is all clean. Then a small anaesthetic injection is given either side of the base to catch the nerves as they run up the toe. This will lead to the toe being completely anaesthetised so that the remainder of the procedure is completely pain-free. The procedure itself takes about 20 minutes. We allow a good 30-minute appointment. Following the anaesthetic, after a few moments, we test the sensation of the toe with a small, fairly sharp instrument just to see if there's any sensation at all. A small green tourniquet or tight rubber band is then placed over the toe. This helps to prevent any bleeding during the procedure. So once we're happy that the toe has been anaesthetised, the nail is very gently separated from the skin surrounding the edge, and a small lifting instrument is used to place under the nail and just gently lifting up the nail. And then small locking forceps are placed either side of the nail to actually lift the sides of the nail free. Once the sides of the nail have been loosened, a small elevating instrument is placed under the nail, which gradually teases the nail completely off. This is then removed, and then a chemical called liquefied phenol is placed along the nail surface and the nail bed to completely destroy any of the cells that produce the nail from the nail matrix, which is at the base of where the nail was sitting. This then will prevent the nail ever growing back because the cells producing the nail are destroyed. During the whole procedure, nothing is felt at all by the patient except some slight pulling or pushing, but certainly nothing in the way of sensation or pain. Once we've applied the chemical, we then wait for a duration of 1 minute, and this is repeated twice. Having done this, we then clean the toe, remove the tourniquet from the toe. We check that obviously blood return is normal. We wash and clean the toe with another antiseptic solution. And we then place a gauze dressing, followed by a dry dressing and a bandage, and then 2B gauze to keep the bandage in place.
I've come here to have my toenail bed removed because I've had problems with a toenail for several years now, giving me pain, and it's time for the toenail to go basically. The procedure went okay, the nail was removed, and everything seems fine. I had no pain at all. I felt the injections, but not painful. It's just a small sharp prick, I suppose. I've attended Randall's at North Horsham to have the procedure done. I do a lot of walking, and I do have problems when walking, so I'm sure now this is going to help me walk a lot easier.